Namaskaram, Dr. Shalini, Consultant Psychiatrist, Unarv Mind and Behaviour Center. Today we are going to talk about dissociative disorders. Dissociative disorders, it's an unconscious defense mechanism that involves the person's psychic activity, involving the segregation of any group of mental or behavioral processes from the person's psychic activity. It includes four disorders: dissociative amnesia, dissociative fugue, depersonalization, derealization syndromes, as well as dissociative identity disorder. Dissociative amnesia refers to an inability to recall events related to a circumscribed period of time. That is, it cannot be explained by normal forgetfulness. There is a certain period of transient amnesia during that period, and it occurs in 2 to 6% of the general population. It can be due to stress, it can be caused by trauma, but in some cases, profound intrapsychic conflict or emotional stress can contribute to it. During this phase, patients can have suicidal ideation, they can have derealization symptoms, depersonalization symptoms, somatoform symptoms, conversion symptoms. All these can occur during this phase. And generally, it is divided into in localized amnesia, generalized amnesia, continuous amnesia, as well as selective amnesia and selective amnesia as well. So, in terms of when we talk about localized amnesia, it's an inability to recall events during a circumscribed period of time, whereas generalized amnesia is systemic. That is, generalized amnesia refers to failure to recall events related to one's life, and continuous amnesia, failure to recall successive events as they occur. Selective amnesia is ability to remember some but not all of the events occurring during a circumscribed period of time. And generally, what we find in this is amnesia can be due to stress. There can be a history of stress during this, and patients can present with anxiety, panic. Some of the presentations include anxiety, panic, violent outbursts. There can be somatoform symptoms, somatic physical ailments can present. They can also have suicidal or self-mutilation impulses and acts like that. And generally, when we talk about dissociative amnesia, it is a chronic condition where it has to be treated. So generally, management is psychotherapy form of management, cognitive therapies, as well as hypnotherapy. Cognitive therapy can be used to correct the cognitive distortions of the patient, so that it enables them to recall some of the traumatic events from the past. So, as well as hypnotherapy, like hypnotic modes can help to modulate, titrate, and reduce the intensity or intensity of those symptoms. They can bring back some of those dissociated memories. It can help to recall those memories. When it comes to the management aspect, generally it is it has to be through cognitive behavior therapy as well as hypnotherapy, supportive therapy. Group therapy generally helps because during group therapy, the group members as well as the group members as well as the therapist can bring out these symptoms. Generally, these symptoms of this can be brought out through that. Group therapy can assist with that. When it comes to depersonalization, derealization symptoms, depersonalization refers to a feeling of being detached from the body or estrangement from the body, whereas derealization is like it's a detachment from the world. It feels like you're detached from the entire world. So derealization, depersonalization, these symptoms are fairly common. Apart from depression and anxiety, they do present quite commonly. They are a third most presentation of depression and anxiety in some cases. Studies have shown that up to 19% in the population in a 1-year prevalence. And when it comes to depersonalized derealization disorders, they generally can occur as a side effect or as an after effect of psychostimulant drugs such as marijuana, LSD, mescaline group of drugs, also as a side effect of medications such as anticholinergic medications. Treatment, when it comes to the treatment part of it, derealization, depersonalization symptoms, again, they present with increased outbursts. There can be somatoform symptoms, conversion symptoms. Management is generally always therapies because it brings out the lesser known trauma can be brought out through therapy, hypnotherapy, supportive therapy. All this helps with that. When it is under it has come under intoxication, whereas an intoxication has caused these symptoms. Then when that intoxicant has been removed, like such as psychostimulants such as cocaine or marijuana or heroin, when all those psychostimulants have been removed, that period of time can be used for recovery. That it can come back to the recovery, full recovery can be expected. That occurred due to intoxication, when it had occurred due to intoxication. Then in some cases, when it is due to traumatic circumstances, when the trauma is removed, the traumatic factor is removed, then naturally the symptoms will improve. So generally, again, supportive therapy, cognitive behavior therapy, these help the patient to come out with whatever was troubling them or the traumatic experiences that led to this condition. That helps with that. And when the psychostimulant and the drug removed from the body or from the system, that also helps them to reduce the symptoms. Generally, medical management is also given in such cases. SSRI group of medications, antidepressants, anxiolytics can help with symptoms that are presented. Depersonalization, derealization is generally a chronic condition, so symptoms do tend to be aggravated. So it's important to give medications along with therapy is important in these conditions. When coming to dissociative fugue, it's a sudden purposeful travel, unexpected travel away from home or away from one's customary place of daily activities. Generally, what happens is they have an inability to remember that past. They might not actually remember, and they might choose an alter identity for that during that period. It's usually traumatic circumstances such as war, combat situations, rape, or childhood sexual abuse, or any kind of other kind of trauma or dislocation, sudden change from normal, disaster times. All that can contribute to this, and generally during that time, you will find this kind of dissociative fugue. This trance state is followed by generally perplexity, confusion, trance-like behaviors. They might not have any recollection of what happened during that time. And, generally, their emotions and impulses are not. They might have, other than the trauma, they might also have guilt, shame. Those kind of feelings might come in, and fearfulness. They might also have sexual impulses or violent, suicidal kind of impulses during that time. All that has to be detected during this time. They have a tendency to go in for these kind of symptoms as well, perplexity, confusion. They might not recall what happened during that time. So during this kind of condition also, they might not have an awareness of what happened during that. But when they come back, they return from that episode, there is a chance that they might have suicidal thoughts. PTSD symptoms might prevail. Anxiety, depression, all these symptoms can be found during that period, immediately after the dissociation or the fugue episode. They might not have any recollection of that at that moment. So I had a patient who came in who would keep traveling out of her home, marital home, because this was her second marriage, and the first marriage she had suffered a lot of trauma. It was a very traumatic and abusive marriage. But in the second marriage, although she was happy, she had a tendency that whenever any stress occurred, she would have a tendency to move out of the home. and she would not tell anyone. She would have no recollection about it as well. Sometimes she would remember she had purposeful travel away from home, but even then, when she came back, she wouldn't know why she had done it. So she was under my treatment for that. Generally in dissociative amnesia, we don't have, there will be, there will not be a purposeful travel. They will not know why they have gone, and they might not have any recollection of it. Whereas in dissociative fugue, it is a purposeful travel away from home and from one's customary place. So this could be trauma, underlying trauma, PTSD could be some of the reasons for it. Again, medication management as well as psychotherapy. Hypnotherapy might help. At the same time, psychotherapy, supportive interventions, family interventions, supportive therapy, group therapy, all this will help to reduce the symptoms to a certain extent. It will help them with the recovery. When a combination of medication and therapy is given, it helps them for longer term remission, to help them with the symptoms long term. Then coming to the final one in this is dissociative identity disorder. It's previously known as multiple identity disorder. It's a sense of two personalities or alter egos with a certain pattern, different pattern of perceiving, relating to, and dealing with the environment. So there are multiple personalities under one, alters. Which might be, they might be interacting as well. So it is a dissociative, that's why it's known as a dissociative identity disorder. Generally, trauma is traumatic circumstances do contribute. There might be a history of childhood or adult trauma and maltreatment. Any kind of abuse history might be present in these conditions. And generally, it is more commonly seen in women compared to men. Dissociative identity disorder, again, can present with all kinds of somatic and anxiety, depression, violent outbursts. All this can present in dissociative identity disorder. Generally, they don't have an idea. The alter egos will not be knowing what the other person is doing. It's a dissociative identity disorder. So the main purpose of treatment is to bring it together and to make it a whole again. So dissociative identity disorder has a history of trauma. There is always a childhood history or adult history of trauma, childhood sexual abuse. All these can contribute to it. Management again comes under, it can last, and by the way, it can last from minutes to hours, days, anything. It can go on for hours. It's a chronic condition, so it has to be treated. In dissociative identity disorder as well, there is scope for therapies, pharmacotherapy along with psychological therapy. Psychological therapy includes hypnotherapy and supportive cognitive behavior therapy. Group therapies might help in this. It's important to get them into treatment because they have these sudden violent outbursts might be present. They might present with multiple symptoms at the same time. So depending on which which type they are in at that moment, which alter they are perceiving at that moment. So it's important to give therapy as well as medical management. The anxiety and depression part can be taken care of with antidepressants and anxiolytics, whereas the more insomnia, those kind of symptoms, we will need to give sedatives, as well as the therapy part. Therapy part will help to resolve their underlying emotional stressors and underlying problems might be brought out through therapy better. And it's a combination of medical as well as psychological management. Just like all disorders, dissociative disorders are a treatable condition. Just that the person they have to be able to identify it, and they have to be brought in for treatment as soon as the problems are identified. Generally, all these conditions are treatable, and medication as well as pharmacological as well as psychotherapy. So it all comes under treatable conditions. It's a very treatable disorder. Dissociative disorders are common, but maybe not as common as anxiety, depression, and mood disorders, but they are definitely present and are prevalent and can be treated. Thank you.